Welcome to the New Mom Talk podcast, your go-to podcast for evidence-based answers to your burning questions about parenting. Join us as we dive into commonly Googled topics and hear from experts and real moms. Let's navigate parenthood together, one question at a time. Hi, everyone. Today we're going to talk about the benefits of pelvic floor PT, but this time we're going to focus on C-sections, which I'm really excited for because I feel like we've had quite a few different episodes where we talk about the benefits during prenatal, postpartum, and a lot of that it tends to be targeted more for a vaginal delivery because we tend to just assume that our pelvic floor, I guess, is impacted with the C-section. So with that, we have Katie Moise, who is going to share all of her knowledge. So if you can start off by telling us a little bit about yourself and what you do.
Yeah, awesome. Thank you for having me. So I am a doctor of physical therapy and a pelvic floor physical therapist. I own a practice in Atlanta called ATL Pelvic Health. And we are really passionate about supporting all women throughout their pregnancy and postpartum to help them feel as strong as they can without having any aches and pains, pelvic floor symptoms while they're pregnant, getting them ready for birth, again, whether it's a vaginal or cesarean birth, and then also helping them recover postpartum, regardless of how they deliver.
Love all of that because I feel like I didn't know what a pelvic floor PT was. I didn't even know that they existed until I started my podcast, which is just under 2.5 years old. And so being that many of us that are listening are either have been pregnant, are pregnant, and that this is not a common thing that you really get told in your prenatal visits. Like, hey, consider looking at a pelvic PT. And here's probably what, or don't even tell me why, just tell me to look into it. Right. So it's crazy. That said, I want to go ahead and just dive into why is a pelvic floor physical therapy important for moms that are having a planned C-section, even though it's a surgical birth and not a vaginal birth. I think that's where we tend to just think, why does it matter?
Yes. And I think there's a couple of reasons. One, people believe that their pelvic floor is going to be spared if they're not birthing vaginally because they're like, the baby's not coming out of the vagina. Everything's going to be better because I'm just having a C-section. And I think we discount how major of a surgery a C-section is. So like if someone were to tear their ACL and have an ACL surgery, there's an extensive 9 to 12 month recovery process for that. And we just, for whatever reason as a society, kind of disregard that for C-sections. And the way we really like to frame it is we want to come at our healthcare system is not structured this way, but we really want to come at it from like a very proactive versus reactive response. So during pregnancy, your body is going through rapid changes through each trimester. There can be symptoms that pop up like low back pain, hip pain, pubic bone pain. And just because you know that you're planning for a C-section doesn't mean that you're not going to experience these same symptoms of low back pain, hip pain, maybe even urinary leakage when you sneeze or cough, things like that. And so we want to set up a strong foundation for your body as it continues to change throughout each trimester to kind of stay ahead of these symptoms so that they don't develop. And then we also really want to look at setting you up for success for your postpartum recovery. So if you're in your pregnancy and we know that there's a planned C-section in your future, we know that you're going to have a harder recovery from the perspective of potential pain, a lot more abdominal weakness because your abdomen not only has stretched during pregnancy, but you also have this incision that now needs to heal. And so what can we do from a perspective of creating more space in your pelvis and your abdomen to make that C-section recovery easier? But then also, can we start to lay down the foundation now during pregnancy for strong core muscles, strong pelvic floor, so that when you're postpartum, we already have a little bit of that foundation set up. And so you're not starting from scratch there. And so I think it's really important to work on addressing anything that comes up during your pregnancy, not disregarding those symptoms, because a lot of times we're just like, it's normal to have back pain and to waddle around because we're pregnant. And yes, it's really common, but we shouldn't have to be miserable during our pregnancy. We want to stay as active as you are interested in being. And so helping people kind of reach those goals, but then also really laying down that foundation for their recovery postpartum.
Yes, such valid points. I have a hard time not comparing this pregnancy to my first one because my first one was so easy, smooth. I literally ran and did boot camp up until the day that I had my son. But with this one, I just feel so much more pelvic pain and I'm going to have another C-section. But I'm like, oh my God, I did not feel this first time around. I think I had only one pelvic floor PT visit after I had my son. I was lucky, I guess.
Yeah.
But it is so crazy how now I'm like, "Oh my gosh, my back." I have lower back pain, so now I've added my chiropractor, I've added acupuncture, I've just added all of these things that I didn't do the first time around, and I really wasn't that much younger. So,
Yeah.
all of all of that said, would you be able to share any specific exercises or techniques that can help prepare the body for a smoother C-section experience or that postpartum healing that is definitely a lot more different than a vaginal recovery?
Yeah, definitely. So when we're working with our pregnant patients, especially as they get towards that third trimester, we do want to focus on like hip and spinal mobility and seeing how we can potentially open up and create space in the abdomen where it kind of feels like there's no more space left because your baby is occupying so much of that space. And so I really like to do exercises like cat cow, thread the needle, figure four stretch, some different hip mobilities where I call it like a Z sit, which is similar or is like a term in Pilates, but also like a 90-90 where you're kind of moving your hips back and forth to get some hip internal and external rotation. Even some side bending stretches. So your obliques are part of your core. They're going to be less impacted from the incision of a C-section than like your rectus abdominis, your six pack abs. And so early on in your postpartum recovery, we want those obliques to kind of help with some of that abdominal support. And so if we can create some space and opening and stretching of the obliques to make sure that they're really mobile and also strong, with some side bending type movements can also be really helpful as well. And then we also want to focus on some gentle core activation. So I like to do that in either like hands and knees or kneeling for like our late stage pregnant mamas. And so that can look like just even like starting to imagine like hugging your babies with your abdomen. So like wrapping your abdomen around your baby as you exhale to get some of that deep core engagement. And then moving into like a bird dog type movement, moving your opposite arm and leg, or doing a kneeling palif press where you're pressing weight or resistance band straight out in like a tall kneeling position. So those are some what we would call like anti-rotation exercises that work on core stability that again are going to help with that core recovery after your C-section.
Love that. So, with this next one, given that, a C-section, you're cutting 7 layers in, your core is a lot more impacted. How does pelvic floor PT help the issues like scar tissue, posture, and just the overall abdominal function after you've had this major surgery?
Yes. So I think this is the one thing that we hear this a lot in the clinic is moms who have C-sections just kind of disregard pelvic floor therapy afterwards. Because it's just not really talked about. But the other thing is that there's just not like a lot of education in general about what to do after a C-section. So no one's telling you how to move your body, how to protect your abdominal wall, how to poop without straining, all of these types of things. They're definitely not typically talking to you about moving and mobilizing your scar tissue. And so these are things that we want to start pretty early in the postpartum recovery period. It's really common for C-section moms to have a lot of sensitivity around that scar. Depending, if it's a planned C-section or an unplanned C-section, there can also just be a lot of emotions tied into even just like looking at the scar, touching the scar. That can be a huge deal for people right after having that surgery, especially like first time moms where it was maybe not a planned C-section. And so we want to work with our patients on helping to decrease the sensitivity of that scar so that you can wear a pair of leggings or a pair of jeans and it's not constantly being irritated. That can start with really gentle things like using a cotton ball to just move the cotton ball lightly around the abdomen. So not even directly over the scar, but kind of around the scar. And then as that scar starts to heal, you can go over the scar directly with a cotton ball. And then we can start doing some more direct techniques of scar mobilization. I always tell my patients scar tissue is kind of like getting gum stuck to the bottom of your foot, where it's like just this sticky feeling all the time if we're not moving it around. And so we want to touch that scar and move the scar so that the scar tissue lays down really nicely so that it doesn't start to impact how you're able to strengthen your core muscles. I've worked with patients who 20 years removed from a C-section and they'd have like bladder symptoms like urgency, frequency, constantly feeling like they need to pee. And when we work on scar mobilization, their urgency symptoms improve. So the interesting thing about scar tissue is what we see on the surface. So when you look at your abdomen and you see your scar, is kind of like the tip of the iceberg. But scar tissue can kind of infiltrate all through the abdomen and the pelvis. And so if we can help move that tissue so that it lays down nicely, hopefully we can avoid um, impacting your bladder function. It's actually really common, and I think something we don't think about for women after a C-section to experience pain with intercourse. Again, because there's so much tissue restriction in that lower abdomen that will actually start to impact the pelvic floor. And so, again, we want sex to be pleasurable. And one way that we can kind of help with those symptoms is making sure that we're addressing the scar tissue. And again, looking at your pelvic floor as well, because it's going to be working with your core muscles. Your pelvic floor was stretched and lengthened to support growing your baby. So even though the baby wasn't born vaginally, it's still going to be impacted from just supporting that uterus for basically 10 months. So really looking big picture at these people to see how can we make sure that you're healing in a way that's supportive so that you're not dealing with back pain, you're not peeing your pants, you're able to, have good sexual health that isn't painful, all of those types of things.
Hi, everyone. It's your host, Mariella. I wanted to thank you for listening and share some ways to show your continued support. You can rate and review on Apple Podcasts or Spotify. Share the show with friends and family. Buy me a coffee to help with the financial cost of running a podcast. Follow me on Instagram at Mama Wears Athleisure. And finally, subscribe to my newsletter. Thank you for listening. So I wanted to draw the attention to a couple of things that you said. So one is that we get absolutely no feedback or no direction on essentially like how to get back into, that working out phase once you've been cleared to work out right, which from my first experience, I think it was 6 weeks. Like, okay, yeah, you're at your 6-week mark. You can go ahead and start working out. But the other thing was like, I remember not wanting to look at my scar. Like, I just couldn't. Not only was it the emotions and, you're in this postpartum where you're so sensitive and everything makes you cry and you just break down, but it was just like, oh my gosh, like your body is not your body. And then you see this scar, which again, I couldn't even look at it. I just would have my husband look at it. Like, does it look fine? Does it look okay? It's just this like discomfort.
Yeah,
So
no, totally.
So just, listening to you talk about those two things was so like deja vu. I'm like, oh my God, I remember just having to figure out on my own how to get back into building up that core strength and easing into it and not just being like, well, I ran up until I had my son, so I'm just going to jump back in 6 weeks later.
And it's so wild because a lot of people do that because the language that's used at your provider is that you're cleared. And so we just go from basically doing nothing for 6 weeks because we're scared to move. We don't know if we can be doing anything for those first 6 weeks. And then you get cleared and you're like, let me jump straight back into like whatever it was that you enjoyed doing. And part of that, I think, is like, that postpartum period can be so hard. It's like part of your identity, if you enjoyed working out, was like, I just want to feel like myself again. And the doctor cleared me. So like, sure, I can get back to like my boot camp classes, my HIIT, my CrossFit, my running, whatever it might be. And really, in reality, it's like there's so much that we can do in those first 6 weeks to lay down the foundation. And then we need to keep building on that so that you can get back to those activities. But the 6-week mark is kind of an arbitrary number that doesn't really mean a whole lot in the grand scheme of your body and healing.
Yeah, it's pretty wild. So that said, when should pregnant moms start pelvic floor PT if they know that they will be having a C-section? And how long should they also continue during that postpartum stage?
Yes. So this can be different for everyone. The way we like to frame it for people is the sooner the better. we love to just get a baseline for our moms sometime in the second trimester. So we can do an internal assessment of their pelvic floor if they're comfortable with it. If they've had a previous C-section, we're definitely going to look at that scar tissue and just kind of see how their body is functioning and moving and come up with a plan. If they're not having any symptoms, we might just want to periodically check in throughout that first and or second trimester, and then in the third trimester ramp up how often we're seeing them as we're getting closer to surgery date. If somebody's having symptoms of any kind, so back pain, hip pain, urinary or bowel challenges, pain with sex, we're going to see them more frequently while we're getting their symptoms managed. And then for postpartum, we like to look at postpartum truly as like a year of healing. We do not need to see people weekly for a year. Early on in that postpartum period, we do want to see them more frequently as we're kind of laying down the foundation. But then I really believe that as you progress through that first year postpartum, you do start to become more active. Your baby is getting bigger. I now have a 2-year-old where like sometimes the movements I'm doing to get her like in the car and she's in the middle of a tantrum, like we want to make sure that your body can twist and rotate and bend and do all of these things and be supported without symptoms. And so really making sure that we're checking in that first year and making sure hips are strong, core is strong, and that your body is really resilient for whatever motherhood throws your way. And so that's kind of how we frame it with our patients, is really looking at postpartum more than just that fourth trimester, which is those first 12 weeks.
Well, finally, my last question. Do you have any other tips, suggestions, or recommendations for any mom that either has a scheduled C-section or recently had one or might have one?
Yes. Some of my biggest tips, definitely if you're going into the hospital knowing you're having a C-section, it's really common after surgery to be dehydrated, which can lead to a lot of constipation. That first bowel movement can be really challenging. And right after surgery, we want to really protect the abdominal wall. So we want to avoid a lot of straining, pushing, things like that. And so it can be helpful in your hospital bag to pack like chewing gum, if you don't mind chewing gum, to kind of help with stimulating digestion to get things moving. I'm also a huge fan of magnesium to help keep stool soft, and just making sure you're drinking a ton of water. So if you have a partner there, bringing a water bottle, the hospital usually provides one that's an easy straw to sip out of, and then having this constant reminder to be sipping fluids. I also tell all of my patients I'm a big lover of the squatty potty. So if you don't have one, I highly recommend. They do make foldable ones that can be easy to pack in hospital bag, but you can also just take like yoga blocks or something, or even at the hospital, turning a trash can on the side and putting your feet up on the trash can so that we can help make that first couple of bowel movements a little bit easier to pass. So that's one of the big tips I always love to tell people about, because I feel like women can be really scared about that first postpartum poop. And especially coming out of surgery, it can be a little bit more challenging. And so setting your body up for success for that, not only right after surgery, but like long term, I think is really helpful.
Thank you so much. I appreciate you taking time and walking us through all of this because, as I mentioned, I feel like a lot of the pelvic floor stuff tends to be very much focused on the prenatal postpartum, but more so like the vaginal birth, because we assume or think that if you're having a C-section, your pelvic floor really isn't as impacted.
Yes.
And I can feel this child of mine on my pelvic floor.
Yeah.
So I know it's impacted.
Yes, absolutely.
Thank you. And I will have all of your information linked in the show notes. If anyone wants to reach out to you, wants to get in touch with you, they can do so through the show notes.
Thank you so much for having me.
Thank you for listening. Tune in next week for our next episode. You can find us on Instagram for more updates and tips. Be sure to subscribe wherever you listen to your podcasts and give us a review if you like us.